This is Dr. Laroche, and I'm going to talk to you about early lens extraction with a Micor 700 and MIGS for the treatment of glaucoma. We've previously shown that early cataract surgery and affordable Sinskey hook goniotomy in Black and Afro-Latino glaucoma patients, a 6-month retrospective study, lowers intraocular pressure very well. The mean age in this report was 65, and we showed in this cohort of patients the intraocular pressure was able to be decreased by about 20%, and the medication decreased 71%, and 78 of patients no longer needed medications. You can see the mean pre-op IOP of 16.45 on 1.81 medications, and post-op 13.24 and 0.52 medications. There's a new technology called a Micor 700, a disposable Micor extractor. It's reusable, gentle facial treatment, a quick OR setup, very highly flexible, and it minimizes thermal damage with cavitation, less oscillation, about 1,000 times less energy than phaco to do cataract surgery. And here's a case I did. It's very good for soft lenses in people age less than 70, I find. I do a nice hydrodissection. I like to prolapse the nucleus if possible because you can do phaco in the anterior chamber safely. This is the Micor 700 tip, and the tip oscillates back and forth and has aspiration. And it's good to use with a chopper so you can chop and engage the nucleus when you're doing the lens extraction removal with the tip. And you can use it safely in the anterior chamber because it's much less energy, so you don't have to worry about corneal edema as much. And so I'll just use a motion of chopping, bumping, and aspirating using this low energy lens extraction removal technology. And so the tip is oscillating very rapidly, and the aspiration is removing the nucleus as well as it's being debulked. And so this is coming along nicely, and the nucleus is almost completely removed here. And then I'll remove and bring automated irrigation aspiration. You change the handpiece, and this is the aspiration handpiece. There's no foot pedal, so I'm using a finger depressing device that's creating the energy and providing the energy for the aspiration. And the stronger you press down, the stronger the energy for aspiration. Same thing with the lens extraction power. The more you press down, the stronger the energy. There's a capsule polisher at the tip that you can use for capsule polishing on this device here. And gonio on top of the cornea to rotate the head. And you can see the clear view of the angle you have once you put the gonio lens on. There's no edema that's seen, and you have a nice clear view. I make an incision with the MVR blade. And I'll use a Sinskey hook here where I engage, make a pass to the left and a pass to the right. And this is a 200 micrometer tip, blunt back tip against the back wall of Schlemm's canal, so you don't get much bleeding at all, and you get a nice opening of Schlemm's canal there. And I'm going to remove the viscoelastic with the automated irrigation aspiration medication use. And see, I'm putting BSS here, and you'll see the blanching of the superior vessel there, confirming outflow to the aqueous channels. Now, this is a slide to the left that shows the angle view with the Micor that was done, and you see the clear cornea. And to the right is a case I did phacoemulsification on that I had some corneal edema on. And you can see the cloudier view I have of the angle here. Now, in this study, patients who have been on medications for more than 4.5 years had lower success rates of abinternal microhook trabeculotomy. So the earlier you do the surgery in patients by taking the lens and angle surgery, the better results that you have. It's important to keep the eye pressurized and the head elevated after surgery to reduce hyphema. Complicated cataract surgery and micro-invasive glaucoma surgery is very effective in reducing medication and intraocular pressure. Micor 700 cavitation-free lens extraction has less energy and potentially safer for clear cornea and concurrent micro-invasive glaucoma surgery.